Sean Willingham, the Medicare man, here to talk about a very important topic, and that is deciding whether or not to enroll in Medicare Parts A and B when you turn 65. Now, I'm going to switch over to a screen share, stop the video, share my screen, so you can see this really neat fact sheet that Medicare has put out called Deciding Whether to Enroll in Medicare Parts A and B when you turn 65. And it's going to do a couple things for us. First, it's going to help us to determine when the initial enrollment period is, and then help to decide when to enroll in Medicare Parts A and B, or whether to enroll in Medicare Parts A and B. The third topic on finding out how to sign up for Medicare Parts A and B, that's a separate video. That is the Medicare enrollment period video, where we talk about initial enrollment, special enrollment, general enrollment. So we won't get into that today. We're going to determine the initial enrollment period and help to decide whether or not to enroll in Medicare Parts A and B when you turn 65. So first step, determining the initial enrollment period. Well, that's the 7-month period that surrounds the month of your 65th birthday. So the 3 months before the month you turn 65, the month of your 65th birthday, and the 3 months that follow the month that you turn 65. Important note here, if you're born on the first day of the month, then your month that you turn 65 is actually the previous month. So if you're born on July 1, well, then June is considered the month that you turn 65. But for every other day of the month, it is as it sounds. And the enrollment period has automatic effective dates assigned when you get signed up. And we hit that in detail in the other video where we talk about the enrollment periods in detail. But that is how to determine your initial enrollment period. So then the next question is whether or not to enroll in Medicare Parts A and B when that initial enrollment period comes up. Okay. Now, it says here, most people should enroll when they turn 65, even if they have insurance from another employer. But we're going to hit some very, very specific details. And what you'll want to do before you hammer out these details is figure out how much the government would charge you for Medicare if you were to enroll. That's going to be a valuable thing to know. It's a very easy thing to determine. You go to the Medicare and You website, or the Medicare.gov website. Click on Basics, then Medicare Costs. Get Costs. And it's going to say on there that Part A is 0 for most people. What you need is 40 credits or 10 years of work, and you get premium-free Part A. Part B in 2024 is $174.70 a month for most people. Some pay a higher premium for Medicare Part B. That would be individuals with a modified adjusted gross income of $103,000 or less. That also applies to someone that files jointly and has a joint income of $206,000 or less. So what you're going to want to do for determining premium in 2024, because it always goes back 2 years. So if you're listening to this video in 2025, you'll actually look at your 2023 income. If you're listening to this video in 2026, you're going to look at your 2024 income. But if you're in this year, 2024, you're going to look at your 2022 income. Okay. And that is going to land on one of these brackets. And then that will tell you what your premium would be if you were to enroll in Medicare Part B. So you're going to want to get those written down. A, 0, B, for most people, $174.70. For some individuals with higher income, it's a greater amount. But get that written down so that you know what you're dealing with when you or if you were to get signed up for Medicare Parts A and B. Now, after determining how much you're going to pay for Medicare Parts A and B, Now we're going to talk about whether or not you should enroll in Medicare Parts A and B. That depends on your coverage that you have access to in addition to Medicare, if any. So, for example, if you are currently on health insurance from a previous employer, this could be COBRA or retiree. Well, then, yes, you're going to want to get signed up for Medicare Parts A and B during your initial enrollment period. If you don't, you're facing lockouts and penalties. Don't want to do that. Okay. Second scenario, you have TRICARE, CHAMP VA. Well, your decision to enroll in Medicare Parts A and B depends on whether you're eligible for premium free Part A, the 40 credits we talked about earlier. If you're eligible for premium free Part A, you are required to enroll in both A and B to keep your TRICARE or CHAMP VA coverage. If you're not eligible for premium free Part A, enrollment in Medicare Parts A and B is optional. Know that if you don't enroll during your initial enrollment period and you sign up later, you're going to be facing those same lockouts and penalties for not signing up during your initial enrollment period. Now to move on to a very common scenario that we run into, and that's people that are still working. They have health insurance from their job. This health insurance could come from either their job or a spouse's job, okay? In this scenario, it says, I have health insurance based on my or my spouse's current employment from an employer with 20 or more employees. 20 or more. This is the key, 20 or more employees. Now that's belly buttons on payroll. Okay. It's not how many people are on the health plan at your employer. It's how many people are insured or are employed. How many people are employed by that employer. If it's 20 or more, well, come down here. If you do not have a health savings account, if you are not making contributions to an HSA or health savings account, well, it says if you qualify for premium free Part A, you should get signed up during your initial enrollment period. Okay. The Part B, you could choose to delay until you or your spouse stop working or lose that employer coverage. Now, this is very, very common that a person that has health insurance from an employer of 20 or more employees, that person can choose to delay their enrollment in Medicare. They don't have to worry about penalties. But it's important to note that a person that is on a health plan of 20 or more employees from their job, they're still entitled to Medicare. They're eligible for Medicare. So they could choose Medicare instead of their employer group health plan. The choice is theirs. They could pick either one. They're eligible for both. But if they choose to not enroll in Medicare, as long as they maintain that coverage through active employment, either their self or their spouses, well, then they don't have to worry about late enrollment penalties getting signed up for Medicare later on, because they'll qualify for what's called a special enrollment period that we discuss during the enrollment period videos. Now, so that is not on a health savings account, yes to Part A. You can choose no to Part B and not be penalized. Now, what if you do have a health savings account, HSA? Well, if you are on a group health plan, it's greater than 20 employees, and you have an HSA and you want to keep making those contributions, well, then what's going to happen is you're going to want to delay your enrollment in both Part A and Part B until you stop working or lose that coverage. Now, the reason why this is if you enroll in either A or B, then what that does is that in turn makes you not qualified to make those HSA contributions. So that's why if you're going to want to continue to make those HSA contributions, you're going to want to delay your enrollment in both A and B. Okay. Very good. Very good. Now, The reason why you're able to delay your enrollment in Medicare Parts A and B and not face penalties is because if the employer has 20 or more employees, well, then what that means is that the group health plan is the primary payer. So Medicare in that circumstance of 20 or more employees would be secondary payer, therefore not requiring you to get signed up for Medicare because the government's saying, you know what, the group health plan is paying first. You get it signed up for that. That's a total valid reason to not get signed up for Medicare. All right. Now we're going to move on to the next scenario. The next scenario is having health insurance from current employment, yourself or your spouses, but the employer has fewer than 20 employees. In this circumstance, you should sign up for parts A and B during your initial enrollment period. This is because Medicare pays before the employer insurance. You look here in the Medicare and U book, it says if you are right here, you got fewer than 20 employees. Medicare is the primary payer. So the reason why you need to get signed up for Medicare Parts A and B is because page 22 of the Medicare and U book says if your group health plan is the secondary payer, you'll likely need to sign up for Part B before your insurance will pay. So, what I call this is a snake in the grass. If you are insured by an employer plan and the employer has 19 or fewer employees and you have some sort of a claim, you could be facing a nightmare when it comes to getting those bills paid because the insurance company can say, hey, he or she was supposed to have Medicare. They were supposed to pay before us, and we're not responsible for the bill. So that's what I call a snake in the grass. We don't like snakes in the grass. We want to get rid of them. And so that's why when you are on a health plan of fewer than 20 employees, you need to get signed up for Medicare Parts A and B. Okay. Now, at that point in time, you could actually choose to use the employer health plan, the group health plan, as secondary payer, or you could choose to not be on the employer health plan and get your own supplement or advantage plan, whatever you like. That choice is yours. But what choice is not yours is deciding whether or not to sign up for parts A and B. That is something that you should definitely do. Now, moving on to individual health coverage. Marketplace, Obamacare, goes by many names, but this is going to be health insurance that's not through an employer. With that, if you're eligible for premium free Part A, which most people are, you should sign up for Parts A and B when you are in your initial enrollment period when you turn 65. If you're on a marketplace plan and you're getting a premium tax or a premium subsidy or tax credit, that's going to start, or that's going to stop rather. That tax credit or premium credit will stop when your Medicare Part A coverage starts. And you don't simply says you don't need this coverage once Medicare begins. When you become eligible for Medicare, if you're eligible for premium free Part A, you're no longer Obamacare. You're now Medicare. Got to make that transition. Okay. Now, what if you have VA coverage? Well, with VA coverage, you should enroll in Medicare Parts A and B when you turn 65. And that's to cover you for services rendered outside of the VA system. Also, because if you don't sign up for Medicare when you're first eligible during your initial enrollment period, and you want to sign up for Medicare at a later date, the VA does not qualify you for the special enrollment period, and you'd be facing penalties. So if it's VA coverage, you want to get signed up for A and B. And then finally, I think this one might not even need to address, but we'll do it anyway. If you don't have any health insurance at all, you should definitely get signed up for Medicare Parts A and B during your initial enrollment period. The That concludes our conversation regarding should I sign up for Medicare when I turn 65? If you have any questions about how to get signed up for Medicare, then what you're going to want to do is you're going to want to watch another one of my videos. I'm going to stop this screen share, turn the video back on. All right. So if you now have questions about how to get signed up for Medicare, the dates that everything will take effect, well, then you're going to want to watch another one of my videos that is about the enrollment periods, being the initial enrollment period, special enrollment period, and the dreaded general enrollment period, which you want to avoid. And to learn why, you'll definitely want to watch that video. Thank you very much, Sean Willingham, the Medicare man, wishing you a wonderful day. Goodbye.